welcome back to my channel. I hope everyone is doing well. So in today's video, I wanted to talk about how do you become an expert in selling? How do you become an expert in selling Medicare or marketplace health insurance? If you want to know how to become an expert, and I'm not going to talk about like tools or websites. I already have a video on all of that, how to become an expert using websites and such. I will link that in this video, but I'm just talking about how to become an expert as far as like helping clients with difficult situation. That's what this video is about. How you become knowledgeable and how do you grow your book by becoming an expert. So this is what we're going to talk about today. And this is going to sound so cliche, it's going to sound so basic, so simple, but it's actually really difficult for a lot of agents. So we know that 90% of agents fail, and this is where I think they fail at is, the expert part. And it's pretty simple. It's pretty simple, okay? So how you become an expert is basically going to your appointments. It's basically calling your leads. It's basically taking one day at a time and not giving up. That's the truth. That's how you become an expert in pretty much anything. Not giving up. If you consistently do it, you're eventually going to become an expert in such topic, okay? So let me give you an example. So if I go see a client and they say, oh, I have to pay a Part D late penalty. Why do I have to pay this Part D late penalty? I probably don't know, right? If it's my first encounter dealing with that situation, I probably don't know. What do? You don't say, oh my God, this is hard, I can't do this, I'm not doing this anymore. You figure it out, okay? You call your upline or whoever is your upline, your FMO or whatever. This is the situation that I'm in, and they're going to walk you through it, all right? And you're going to learn. So the next time someone has a similar situation, you are going to already know, okay? There's a lot of information on Google. I am the Google queen. Of course, everything online is not facts, but for the most part, there is some good sources online. If I want to kind of figure out how much someone is going to pay for their late Part D penalty because say they was not enrolled in Part D for 12 months, okay? They didn't enroll in time for 12 months. You could go on Google and you could find you a Part D calculator and it will calculate it for you. However, you never say this is exactly what you're going to pay. You say this is the ballpark, okay? Because maybe it's more than 12 months, okay? Maybe the calculation is not right. Maybe the calculation is for last year, whatever. So you're going to say, this is your ballpark. This is the range. You're going to be looking at about this. The insurance carrier is going to send you a letter. It's going to let you know exactly how much your Part D penalty is. And these are the steps if you want to fight that, okay? If you can even fight it, okay? So the way to really become an expert is to spend at least 10,000 hours in whatever field, whatever you're trying to do. If you spend at least 10,000 hours in that subject, you will default to becoming an expert. It's that simple. The thing is, most agents fail. They don't call their leads, or they don't show up, or whatever the case may be, okay? And you may not want to call leads. It's not about calling leads. It's about actually getting connected to clients. However you get connected to your clients. It could be based on community, right? Going out there, talking to doctors, hosting events, whatever the case may be, purchasing leads, door knocking your leads, calling your leads. However you decide to grow your book of business, you have to put one foot in front of the other, and you will encounter situations that you have never encountered, and you will learn the process as you go. That's how you become an expert. Let me give you an example. A client comes to my office, walks into the door. Of course, at this point, he's walking in, so he's not a client, he's a potential client, right? He never enrolled in Medicare Part B because he felt like he could not afford it. I did not say, oh, you're going to pay a penalty of such and such and such. I said, let me ask them the appropriate questions. What are your pain points? Why did you not enroll in Part B? I need to have a conversation to see if I can help this individual. During the conversation, guess what I found out? He's low income. He's low income, been low income since day one. Could have been on Medicaid since day one. He would not have to worry about Part B. I don't know. I feel like he probably was stubborn when he turned 65, didn't want to hear no advices. And he got to the point where he was like, I need help, I need help, I need help, I need help. He's seen my office, right? Came in, I need help, I need to start going to the doctor. I'm in my 70s, can you help me? And I asked him the appropriate questions, figure out what his pain point was, figure out what his pain points were, and it was a solution. I had a solution. You're not gonna have a solution for every scenario, you're not, right? But if you ask the appropriate questions, if I had to, I would have called my upline and say, hey, this is the situation I'm in, blah, blah, blah. I didn't have to do that because I kind of know, because I've done this long enough, right? I've put in my 10,000 hours and I figured, okay, let's do this. We're going to apply for Medicaid. We're going to apply for the Medicare Savings Program. And then once we get that, we're going to apply for Part B, okay? By then, Medicaid would kick in. Medicaid would pay your Part B premium, and he loves me. He loves me because I did not just say, oh, you never enrolled in Part B, I can't help you. I said, let's figure this out. What's your pain points? What's going on? Why didn't you enroll? Oh, you're low income. What's your income? Oh, you actually qualify for Medicaid, right? So I was able to figure that out. Another scenario, I had a couple that came to me. Actually, they moved to Leesburg, Florida, where my office is, and their son called. See me on Google, called. Hey, my parents is moving to Leesburg. Their language, there's a little language barrier there, but we can get through this, right? Okay, so fine. So they come to my office, son explains the situation, and they had left America when they were like 65 or so. They had enrolled in Medicare, but they had delayed Part B, went to a whole nother country. I can't remember what country they're from. I want to say Colombia. So they was in a whole nother country, right? Was there, they were going to retire there and all of that. So they come back to America. They decided this is their home. They're going to settle here in Leesburg, Florida. What happened? They get dinged with a Part D late penalty when I enrolled them in their Medicare Advantage plan, because obviously they did not have a Medicare Advantage plan when they came to see me. So I enrolled them in the Medicare Advantage plan. They started getting these letters, Part D late penalty, you need to pay the blah, blah. I was like, bring the letters to me. Let's figure this out. So I read all the letters, called the insurance carrier. What do we need to do? Because this doesn't sound right to me. This does not sound right to me. So we looked at all of the qualifications to get them out of this Part D late penalty, and there was a loophole. They were not here in the U.S. They was not here. That's not their fault. You cannot penalize someone for being out of the country. So I helped them write the letter and show all of the proof, the passports when they left and when they came back, and the years they was in Colombia. We put all that in the letter, and guess what? They don't pay a Part D late penalty, and that is because I take these type of events and I study them, I learn them. I want to know, is there a solution? If there's a solution, let's figure this out. And that's how you become an expert. Guess what? If someone has that situation, they probably gonna be like, oh, call Patricia. Do that mean I can help every person in this situation? No, I would not be able to help everyone in that situation, because everyone is not going to meet the qualifications to get out of a Part D late penalty or whatever the case may be. But what I'm telling you is when a situation comes to me, I don't just write it off. I want to figure it out. I love to solve puzzles. I want to figure out how can I turn this around, and that way learn from it and use that for my next case, right? That's how I became an expert. I just learned it. I learned Medicare. I learned Marketplace. I learned the special enrollment periods. I learned loopholes, I guess you could say, legal loopholes. And I figure out how to help people that are in sticky situations, just like new to Medicare. Some people, all they know how to do is change people plans. They don't like to do new to Medicare because new to Medicare takes a little time. You have to really know your stuff. You have to know how to help people learn the whole Medicare process. In the beginning, that was a little terrifying for me, right? I gotta know what a supplement is. I gotta know what a Medicare Advantage plan is. I gotta understand the deductibles, the different parts of Medicare. But guess what? I took one day at a time. I took one appointment at a time. Simplified it so that way it's simple for me to understand. It's simple for me to understand and digest. It's simple for the client to understand and digest. So I like to take the summary of benefits. I like to read it. I like to understand. I like to understand what is going on in different plans. For example, somebody may say, I want dentures. I want dentures. I need to get dentures done. Not every carrier is going to cover dentures, right? So I'm going to go into the summary of benefits and I'm going to search up the word dentures and see if dentures are covered. Okay, if it's not covered in the summary of benefits, I'm going to go into the evidence of coverage because the evidence of coverage has a lot more pages, and I'm going to search the same thing, dentures or dental implants or whatever the case is, and see if that item is covered. Okay, that's how I start learning the different scenarios and helping clients, because I read a lot about things. I go online and I make sure the online source is legit, of course, and I help educate my clients. If they come with me with something that is a little challenging, a little different, then I'm going to research it, going to call my upline, I'm going to figure out how this works. Like if someone said, oh, I have Medicare and I also have health insurance through my employer, what pays first? You need to know these things. If you don't know them, it's okay. You can research it, you can learn about it. Medicare and U-Book is your biggest friend, okay? It's like the Bible of Medicare, okay? Somebody just got admitted to a nursing home. Can they enroll in a supplement plan? So there's so many do's and don'ts, and can you not? If you research it, the answer is there. And if you keep going to your appointments, I promise you, you will become an expert. So that's how you become an expert. So keep going. Keep putting one foot in front of the other and keep meeting clients, and you will, I promise you, you'll become an expert. Now, if you do it as a hobby, then that's a different story. Then it's a lot harder to become an expert, all right? Anyways, I hope you guys enjoyed this video. Thank you so much for watching. Please like, comment, share, and subscribe. See you on the next one. Bye, guys. Peace and love. Bye.